That's important. Next item, we have something on held here on the agenda. Clerk, would you read that item before I make a comment?
Item 25-0419, a resolution authorizing the payment of a grant construction payment to VNA Healthcare in the amount of $500,000 to defray the capital costs of the construction of the Weston Avenue Primary Care Center.
Okay, albeit that I'm new chair here, can somebody explain to us first and foremost why it was held?
I believe there were some additional questions and some additional backup information that the new administration needed related to this particular item.
All right.
It's my understanding that those questions have been answered.
Okay, great. All right, and who's going to lead the presentation today?
Go ahead.
Okay, thank you.
I'm here to answer questions.
Okay. Bloomhaven is a mixed-use redevelopment of the dilapidated site of the former Copley Hospital campus, just south of the downtown in the city of Aurora. It represents approximately a $129 million investment in the community, and the site incorporates senior housing, medical offices, a school administration building, a community park, and also contains Bardwell residences, which includes 99 Studio 1 and 2-bedroom apartments. In addition to the amenities described, the developer has also leased a portion of the campus to VNA Health for the construction and operation of a health clinic on the campus. VNA Health provides healthcare services at several locations throughout the city and regionally as well. They also fill a need by providing quality, affordable healthcare regardless of a patient's insurance status or ability to pay. Their services are crucial for community well-being for city residents. The Bloomhaven Clinic was constructed to provide an array of services, including primary care, mental health counseling, immediate care, women's health, OBGYN, pregnancy care, and pediatrics. The VNA Clinic is viewed as a very beneficial service to have available on the Bloomhaven campus and for the surrounding neighborhood and area to meet area healthcare needs. As such, city officials met with VNA in July of 2024. City wished to contribute to the financial well-being of VNA's clinic and made a pledge of city financial support to the clinic in the amount of $500,000 to defray the construction costs. The pledged financial support was to be released upon completion of the clinic and issuance of a certificate of occupancy. Relevant terms were memorialized in a letter from the summer of 2024, which is also attached in the packet. The clinic was completed in April of 2025, and the city did receive a request from VNA Health for the pledged revenue and payment, and it is appropriate that the payment now be approved for release in accordance with the funding pledge. Funds are available for this purchase. Staff is therefore requesting a motion to approve the $500,000 disbursement to VNA Health to defray the costs of the Bloomhaven Clinic as pledged by the city. And with that, I'd be happy to answer any questions.
I'm going to let the committee go first. Any questions by any members of the committee? All right, Alderman Larson.
Yeah, I have some questions. So it says that this is budgeted in the 2025 GO bond fund, and it's been earmarked. So is this included in the 2025 budget process?
Due to the timing, it was not actually incorporated within the budget process, but we do have funds available to effectuate the $500,000 payment.
Okay. I guess my question is it normal for money to be pledged? As I understand, the city council has to agree on expenditures over a certain amount. Is it normal for $500,000 to be promised without city council approval, or was this approved by city council before I was on?
It was not approved by city council. This is the first council action that is being requested for this particular tranche of funding.
Okay.
The reason why it was held was because we were confused. This administration was confused when we saw this on there, is because we saw that it hadn't gone through council. And for a ticket like this, a redevelopment agreement would most likely go to council for a vote. So I truly think this was just an oversight of the last administration. But there was there was a letter as well as many emails back and forth that we were able to find committing this money. And while it is a bit of a legal gray area, whether we actually owe that funds, we are in support of the VNA and the work it does. We want to make good on this promise, but it was an oversight.
Yeah, and that is correct. There is an email trail that goes back to last summer between the city and VNA that does pledge the revenue and the support. Excuse me, pledges the payment and the support to the VNA clinic.
Okay. Yeah, I understand this is a promise that we're expected to follow through on. I guess it puts us in a tricky situation, but it's where we are. So thank you.
Alderman Bug.
Thank you. Chief of Staff, you're being a little bit more gracious than I'm going to be. This was pledged by one person. the mayor of this city, former mayor. There was no consideration given to this council. There was no memo. There was no resolution in July 2024. I trust as we go forward, the new administration will act under the guidance and our set regulations in the finance department. So yes, our new alderman is correct. Everything over $50,000 comes before this board and tribunal. So a letter from our former mayor to VNA, no matter how much good they're doing, and they do vast amount of good work in our city. That was an agreement between the mayor and that CEO. There was no mention in the letter that the mayor would be seeking the approval of the city council. It says that the finance department will get the letter requesting the funds and finance will send it. $500,000.
Excuse me, Alderman Bug, the email trail does indicate that there will be an approval process, that it will go through.
We don't have that.
I will make sure you have it for copy.
Okay. I'm reading the letter from the mayor to VNA.
I understand.
And even if it is in the email trail, it did not come to fruition because we're in 2025, summertime. This is complete. When I read this and read it in detail, my dear friend, Alderman O'Connor, was in my ear because he hated ratifications. And every time a department came for one, we let them know that that is not the way we do business in the city of Aurora, the finance department, or the city council. We do not ratify things. We do not find out after the fact. Because that
agree.
is a disservice to our citizens.
I was simply going to indicate that I agree with your opinion and your discussion points, Alderman Bug, and we will hold the number of ratifications to an absolute minimum and maintain them only for emergency types of items.
Yes, that is what ratification is for, pure emergencies. And they happen.
I will also just say from your earlier point, Alderman Bug, that it is an early on cautionary tale for all of us to make sure that we're always following our due diligence, as we want to make sure that we're passing through everything through the proper processes and following all of our city code and ordinances.
Okay. So I will just say this. I don't know if you're going to put it through to a vote, Chairman. I would definitely have the VNA here at COW because...
We actually do have a representative of VNA present today.
Oh, please stand up.
Good afternoon, Linnea Wendell from VNA Healthcare.
Welcome. Go ahead.
I'll let you speak. I know you have read the two letters that we have in our packet.
Mm-hmm. Yes.
So I'll let you speak to what transpired, how it transpired, because VNA has received other funds from the city. So I think they are familiar with the process. So even if someone in charge told you something differently, but I'll let you speak to the two letters.
Sure. So just for a little bit of background, you may be aware, but VNA Healthcare was established here in Aurora in 1918, and indeed we have had great support from the city for over 100 years with different projects along the way. We very much appreciate your support. And this project was to construct a 26,000 square foot medical facility at what is now called the Bloomhaven campus. And last summer I spoke with Alex Alexandrou and asked for support for this project. In fact, it was one of a couple of conversations with him, and in the end it was some discussion by email. There was a commitment made, and he indicated in the email that it would go to, this would go through the process, and that once we finished the project, we should submit another letter requesting the funding. So that's how it occurred.
Okay. And like I said, VNA has had other things come through, quote unquote, the process. You've been in front of city council before.
Yes, we have. I'm trying to think of the last grant, probably for Indian Avenue or the Wellness Center. Yeah, probably in the administration prior to the last one. Yeah.
I mean, you're not responsible for the actions of the administration. However, over the last year, when normally you would be given notice, your item, like we call them agenda items, is up for consideration, and you would come to either COW or City Council, and possibly questions might be asked, maybe not, and then it would pass, and that's kind of the normal course, and VNA has gone through that. So when that didn't happen, were you concerned, or you have a lot of things on your plate. Like I said, you're not responsible for the process that this went through with the administration. But did it ring somewhere that this did not happen?
No, I had received an email saying that there was going to be some action that would take place through the process, and I wasn't asked about it, and I didn't think about whether there was something that I needed to inquire about. Yeah.
Okay, thank you.
Okay.
Comment. So
Alderman Franco.
we have beaten this dead horse down for the process. The process apparently was not followed. We get that. What's in front of us today? Do we feel we should honor that? And do we not feel that $500,000 for affordable health care in East Aurora is appropriate? That's kind of where we're at right now. We've already hashed out everything else. So I think going forward, if we want to expedite these meetings, let's get down to what we're talking about here. Do we feel that this is worth $500,000? I would say yes. Thank you.
I can only imagine your very uncomfortable position right now, standing there before us. I have a question for you since you showed up today. Can you tell us exactly how you anticipated using this $500,000? Is it for construction? Is it for medical equipment? And the reason why I'm asking is, first of all, when we give money towards construction, anticipate it's being prevailing wage as well. It's a requirement, correct, Mr. Minick?
Prevailing wage does come into those types of funding agreements.
Right.
and
So
construction.
can you explain to us how that $500,000 was allocated?
It was not
In your-
directed to a specific line item. I'd be happy to show some of that information later.
'Cause I think it's important, and I don't have an issue with what any of Alderman Franco or Alderman Bugg has said, but I really do believe that you need to have everything before you to make a decision. I mean, this is a $500,000 ratification with no backup paperwork for us to explain to the community what's it going to, and is it properly, where is it going? It's not that we don't want to support. Everybody wants health care for their community. And we do have a great partnership with VNA. Who did the construction, for example? Mr. Minick?
Doyle.
I believe, go ahead.
Yeah, EP Doyle.
EP Doyle, okay. Is it going towards construction? Is it going towards salary setup? I mean, where's this money going? And that's what we don't have, and that's my biggest concern right now. We don't have data in front of us. As much as I want to move forward too, maybe, and say, yes, I think it's important that we move forward. Where is it going? And
We can give you the full breakdown of the expenses.
I think it's important to have that information. It's not like, again, everybody cares about VNA. Everybody cares about healthcare, especially now and everything we're hearing on the news, Medicaid, et cetera,
Yep.
cuts in Medicaid.
Yep.
But I think it's very important that we know that we're following all the rules, dotting all our I's, crossing all our T's. If this was used for construction, I'd love to know if there's a concern in regards to prevailing wage. I'd like to, it's great to say, yeah, we're going to give you $500,000. I mean, this is mind-boggling again for me as well. Somebody approved $500,000 without any budget presented to the city. It's not always about saying it's too much. Maybe it's not enough, right? As well, and trying to answer those questions for our community. And we're trying to be proper, and I believe it's important that we're proper stewards. So is there a possibility that we can get that information for the next meeting?
For the next.
Next finance meeting. I'd like to have proper information. I want to set the standard of having all the information here before us, moving forward for these items. Again, not against supporting anything, but we're going to ratify. We're going to know what we're ratifying. I think that's very important coming out of the gate here, especially with this administration. And the community knows exactly, and I think the community expects to know that we have the information before us. So if we can have some delineation of where this $500,000 is actually going to, I think that would help out tremendously, because it's not just a ratification. My concern is, at this point, is beyond a ratification. It's just a blank check. I think the community needs to know a little bit more, and I think some of my colleagues should know as well here on this committee.
Yep, we're happy to give you the information of what's been spent.
Yeah, so, I mean, and then the other question is legal here? Anybody here from legal? Mr. Patrick, I wasn't going to let you off the hook that easy today from this one.
Not at your first meeting.
Yeah.
Assistant Corporation Counsel Patrick Collins.
All right, words are important, correct?
Sure.
Yeah, that are written down in
Usually,
particular, yeah, okay. So I'm looking at the legislation text, second page impact statement. It says, the first paragraph, first line item towards the back end, the suffix, fulfill the letter of commitment between the city and VNA. Is that a true statement, between the city and VNA, or is this between the mayor or the chief of staff, the former chief of staff, or the former mayor and the VNA?
I would have to look at that letter and review that and get back to you on that. Having read it, the legal opinion on.
Impact statement.
The impact statement is just in the Legistar covered memo.
Yeah, second page, impact statement.
Yeah, it's a statement, yeah. Are you looking for a specific answer here?
Yeah, I am. Is it between the city and the VNA, or, because the city is who? The city council, correct? That represents and votes on the budget and line items, and this one hasn't been approved by us. So is it proper to say city, or is it more proper to say the previous administration?
I think you're mincing words at that point. In an impact statement, the real crux of the cover memo was all down in the resolution.
Okay. I'm not an attorney, but I've learned things like scrivener errors and whatnot.
And any cover memo is just basically, they're outlining the different points of what's in it, where you have the subject, the purpose, background, discussion, the impact statement and the recommendation is all the preamble, I guess, or like the intro, the
Okay.
beginning of the heart of the matter is
All
what's
right.
actually authorized in the resolution that grants the
All
city
right.
the authority to do what it's doing.
All right, well, I will say that I don't believe it's a full commitment. It says fulfill the letter of commitment between the city and VNA, and this is the testimony provided before us is between Alex Alexandrou and VNA. So I'd like to have a little bit more information on what that commitment is and what that $500,000 is going to. I'd like to hold it here till the next meeting, till we have that data before us. And since VNA is willing, representative from VNA is willing to provide that in terms of what their budget is and where this money is going to, what it's being allocated towards. I understand there's many things. It's okay if it's not construction, but I'd love to know what it's going to specifically. And
Yep, we're happy to provide a breakdown of what was spent on the project.
sure,
Yep.
sure, appreciate that. So if committee has no objection, I'm gonna like to hold this for till the next meeting, and hopefully we can make a decision what we do from there.
I got a comment. Yeah, I agree with you. As I said, VNA does excellent work. You do excellent work. And I don't think this body, current or in the past, has necessarily ever turned down any requests from VNA. So we're just looking at the process now. If in July 2024, you would put forward a request for funding for $500,000 to this body and in a resolution, a grant for VNA, I am 99% certain it would have passed. But just the way it happened was not
It's
under
unfortunate.
the normal process that
It's
we.
unfortunate, yes.
Yes. So I agree with Alderman Mesiacos to just see where those funds are going to be going. And I assume that we have, at least in those two letters, we have the full letters there. But the writer of those letters and the people who were copied, Mr. Alexandrou, they did not request from VNA any type of breakdown, anything.
No.
Okay. Okay.
Okay, what's the next step? Can I just hold it, or do we have to ask for a vote to hold?
I mean, I would recommend, you're requesting hold, do you have a consensus of the group? I think would be more of the appropriate one at this point, or if you want a motion to actually table it here, or you just want to hold it here.
I just want to table it for till the next finance meeting to collect more data,
So are you making
so we have a more understanding of what we're ratifying.
Are you
It's
making
not
a motion to table?
I'm asking if I could just do it as chairman and hold it for another 2 weeks, or does it have to go through a vote?
I would recommend it goes through a vote then if you're just looking to hold it. If you want to table the motion,
How was it held last time?
I was not at that meeting. I would defer to anyone else who was.
I don't even know what game it was last meeting. Is that true? Well, no, I'm sorry.
I think the mayor's office held.
Yeah,
We
the
didn't,
mayor's
we didn't,
office held,
it
yeah.
came
Yeah,
in
yeah.
being held. We did not.
If you want to make a motion to hold it, it'd be voted on by the.
I'd like to know if there's support from staff to hold it until we collect all the data as well, another 2 weeks.
Sorry, excuse me. Shannon Cameron, Chief of Staff. So this wasn't held by committee, it was held by administration, just initially, just so you know, because we wanted to dig in more to this, because the mayor didn't remember it coming through council and just wanted to see if this was part of a redevelopment agreement or what exactly happened with this. So that's why we had kind of done the research. As far as the funds have already been spent, I will say, it's fine if VNA wants to do a report, but I mean, in the end, it's sunk costs. Those funds, that money has already been spent. I will say, hopefully this is an error that
Real
needs
quick,
to.
It's been spent by, VNA's already finished the project.
Yes,
They're
yeah.
looking for reimbursement now. We haven't
Yeah.
spent anything.
Correct.
Okay, all right.
Spent by VNA, I mean, and this is just a reimbursement for monies already spent, and I'm not sure how much council will glean from the details necessarily, because anything could be put in there. I'm happy, to work with them to provide that, but just letting you know that it sort of is what it is, and it's a mistake, and we've got to make sure that we have things in place where that doesn't ever happen again.
I'd still like to have more data personally. I'm not, I don't know what the committee wants to do, but I'm not ready to move forward with it until we have the data. I'm not against ratification 100%, but I'd like to know what I'm ratifying. And this is just a blank check. I'm going to leave it up to the committee to see if they'll hold it, I guess, at this point, until the next finance committee, so we can collect that information. So we forward it to the committee of the whole with eyes wide open and knowing exactly what's in it, especially starting out with this new administration. I need to have carryovers of process and ratifying things. Cart before the horse.
If you're asking, as chair at times, well, not at times, as chair, you can request the members to, as our council said, consensus to hold something, and it doesn't have to go to motion. Or you can make the motion. If you make that motion, I will second it, and we can go forward. But as chair, if we have consensus to hold it, then it's held.
Oh, then I'll make a motion to hold. We have a second.
Second.
All right, so I made the main motion. I have a second from Alderman Bugg. All those in favor of holding it for 2 more weeks to get the data on the docket?
Aye.
Aye.
All those opposed? 4-0. I appreciate that from the committee. This is the most uncomfortable position for myself as well, so ma'am. My first day here as chair, first day as a committee chair here. So, like Alderman Bugg said, 99% sure it wouldn't be an issue before, but I'd like to have everything, all our ducks in a row, moving forward. At least over this next 2 years while I'm here. I don't know what the future has, but if you don't mind,
Yeah,
I
no
appreciate your
problem.
understanding.
Yep.
All right. No need for a closed session.